peripheral T-cell lymphoma are a group of rare disease where the treatment, the standard treatment is not enough. So the majority of patients do not respond or relapse or refractory of the treatment. So there is a huge interest to better characterize this disease and see if we can develop prognostic or protective factors to better treat these patients. And this is the reason because we created two large international cooperations. One is the T-Cell project and the other is the Complete project. Both of them register new cases of peripheral T-cell lymphoma and follow them and see what happens over time.
So what did you find in this study?
So in the Complete study that has been presented at ASH, what we found is that the majority of patients are treated with CHOP, is the standard treatment for aggressive lymphoma, but unfortunately do not respond very well. So there is room for improvement, and this huge database is of paramount relevance to investigate the reasons of failure. Unfortunately, we have no other chances. So we stay on the hope of new compounds that will be more effective compared to CHOP. So
this is a very aggressive disease.
Yeah.
We live in an era of targeted medicines. Do you see any hope coming down the road?
So only in the small group of T-cell lymphoma that express the anti-CD30 receptor on the cell surface, it is possible to use drugs like brentuximab vedotin. For the others, there is no target for a specific treatment. There are some new drugs like alisertib or pralatrexate or romidepsin that probably will enhance our ability to treat these patients. But unfortunately, we lack of the right target to treat these patients.
In the meantime, what's your recommendation about the prudent way forward for treating peripheral T-cell lymphomas?
So start with CHOP or CHOEP, adding also etoposide to the classical CHOP regimen, and in patients that respond well, consider and discuss with patients the role of autologous stem cell transplantation as a consolidation procedure after the achievement of a good response. There are no definite data on the value of high-dose therapy, but retrospective analysis suggests that probably high-dose therapy could be an opportunity for patients who respond to maintain their response and probably to be considered cured from their disease.
So in the brief message in 5 seconds or so to doctors for taking home about this would be what?
Yes, so the message is start with CHOP and then, if it's possible, add also autologous stem cell transplantation.